Hey everyone, I'm Sarah Lavonne and welcome back to my YouTube channel. I am back for this month's Coffee and Questions, which is my monthly series where I answer your questions from comments on previous YouTube videos and then also from Instagram. And so I love this. This is my opportunity to connect with you. It's also an opportunity to expand on previous videos that I've already done. And so throughout today, I'm gonna mention multiple different YouTube videos that I've already talked about, and these are sort of like snippets expanding from that. It may be new information, it may be something that was triggered from that video, but make sure you check out the videos that I mentioned today. We are gonna answer a bunch of your questions. We talk about preeclampsia, high blood pressure in pregnancy. We talked all about tearing. There were multiple questions on labial tears. We talk about placenta previa. There were multiple breastfeeding questions. I give you a Nephew update. I talk about birth trauma. There were 2 different questions from women who had struggled with a traumatic birth, and what does that even mean? If you haven't heard that terminology before, I will mention it today. I talk about brown discharge. There was pelvic floor questions. There was tongue tie questions. There was a lot of things that I will describe and list out in the description box down below, so make sure you check that out to know what today's is about. Also, make sure you subscribe down below, turn on your notification bell. Feel free to share this with a friend. I love it when you do that. And then let's get answering your questions. So I'm gonna go to your YouTube comments. I want to just give you a heads up that recently for this last month, I've had some major issues with my email. So I haven't been seeing your comments as much. So it's actually really fun for me to get to go through all of your comments and look for your questions for this month's time around. But keep commenting because I've figured it out. And so I will be commenting back and paying more attention over the next little bit. The email situation is all figured out. So this one comes from my warning signs of pregnancy video. And Yaya Queen says, I am so scared to go into labor. This is my 3rd baby, but I've been having health issues like blood pressure. Am I just overthinking about all the what ifs? What can I do to lower the high blood pressure? This is probably a video that is coming on its own, all about high blood pressure in pregnancy, all about preeclampsia. And so a couple of things. We do want your blood pressure under control. If you've been having high blood pressure in this pregnancy, you're probably being tracked by your doctor, probably not even your midwife, because you probably would end up needing to go to an OBGYN. And so they should be watching it. Now, you may take medications in your pregnancy, and I do recommend taking those medications because the risk of high blood pressure, and if you want the preeclampsia video, let me know, is that either kind of 2 things. So one would be that if it's too high, you can actually have a stroke, which we do not want you having a stroke. And then the other one is seizures. That's the big thing we're worried about with preeclampsia. And so what you can do to lower your blood pressure pre-pregnancy, during your pregnancy to help control your blood pressure is obviously diet, exercise, like not anything crazy exercise, but staying active, watching what you put in your body, low-fat foods, that kind of thing. Or by low fat, I don't mean like fried foods and processed foods. I mean like if you're gonna do fats that they're like good fats, right? Because there are fats that are good for us. And so, but once you have high blood pressure, honestly, you do those things, you lower your stress, you decrease your caffeine intake maybe, but past that, it's one of those like very uncontrollable things. If you have a gestational hypertension or preeclampsia or an eclampsia, you'd be in the hospital, means you've had a seizure, then the cure for high blood pressure in pregnancy is delivery of your baby. And so if you're diagnosed really early on in your pregnancy, then they're probably gonna wait and see because they're weighing that risk of you have to stay pregnant to grow your baby to be big and healthy and strong with good lungs that are mature versus delivering too early and risking that. And so your doctor's gonna be weighing that out. But that's where, guys, this is why we have an entire specialty of OBGYNs. This is why people go to medical school. This is why you have doctors and nurses and you deliver in a hospital sometimes. So trust your provider that they do care, that there are risks involved. And so I don't want anyone to be negligent about the high blood pressure, thinking like diet and exercise can fix it. Because if you truly have a preeclampsia, the only cure is delivery of the baby. And so be in communication with your provider about that. Obviously, eat healthy, That's like a whole nother video if you want it. There's so many videos, it's never ending videos. And then like exercise, stay active, and then monitor it probably at home. So trust your doctor in terms of the policy protocol, what you do with that. This question is from Pixel Pro 645, and it comes from the live I did with the Vagina Whisperer on pelvic floor. If you haven't seen it, check it out. She says, if I'm already 19 weeks pregnant, can I really improve my pelvic floor in the next 20 weeks before birth? Yes, you can, okay? You 100%, if you have a week, if you have a day, in a day, maybe not so much, but like a week, you have time and 20 weeks to prepare your pelvic floor. It's like, can you get in shape in 20 weeks? 100%. I'm not talking about getting in shape, but strengthening the pelvic floor, making sure that it's nice and flexible and it's also not too strong. 100% you have time, guys. If you haven't checked out that live, check out that live. See a pelvic floor therapist, do your squats, do your deep abdominal breathing exercises. You can learn that from my breathing video, and then flex and flow going forward. But 100% you have time, whether it's 1 week, whether it's 2 weeks, whether it's 20 weeks, 100%. Get on your pelvic floor. That is something you can control to help to support the growing pregnancy and then also to support the pushing and the birth and your postpartum recovery. Okay, Christine Pearl Toledo. This comes, I think, I didn't write this one down. This comes from the mucus plug video, or signs not to go to the hospital. So she says, hi, I'm 40 weeks and 5 days today. I started having brownish discharge yesterday until today, but labor pains are still irregular. Is that normal? So brown discharge, probably, and again, if you have any kind of anything coming out of your vagina, you're gonna wanna check in with your provider to be sure. But in general, a brown discharge, like almost like when you first got your period, like old blood is actually what it is probably just old blood. So maybe you had a vaginal exam, maybe they stripped your membranes, maybe you had sex. Your cervix is so sensitive, sometimes it bleeds a little bit, and if it sits up there for a while, it turns brown. Kind of like our periods, like on the last day of the period or the first day of your period, that discharge is not quite as bright red. It's the same way for brownish discharge. Now, the other concern where I'm like, want to be sure and check in with your provider is that make sure that your water didn't break and the baby didn't poop inside. And you can see my meconium video on that one because I do talk all about that in my meconium video. But honestly, it's probably just old blood. Don't stress about it. It means maybe your cervix is changing. You're getting closer. It is what it is. Don't stress. Serbi jaw comes from my live I did with Goldilocks on breastfeeding, which was also extremely educational. We learned so much. And we were talking about tongue ties. So this is a piece of the tongue ties, which I pulled that clip because it was so helpful and so insightful. All of you guys should be seeing that clip. So check that out. I think it's only like 10 minutes. It might be longer than 10 minutes. I try to keep it under 10 minutes, and Lord knows this one's gonna be like 40. All right, she says, how do I know if the pediatric dentist has the knowledge to do this surgery related to tongue tie? So she has concerns about her baby. So this would be, you call them and you ask them and you say, do you have history of working with tongue tie, oral tie issues? Do you perform frenulectomies? Is that something that you're experienced in? And if not, then ask for a referral. But in general, if you think your baby has a tongue tie, have them evaluated by a pediatric dentist, and hopefully you can get it taken care of, because that's stressful and it may really, really help your breastfeeding journey and then also into their future lives. Clue Flu says, from my VBAC videos, I have 2 VBAC videos. This is from part 1. When trying for a VBAC, are you allowed to labor at home, or do you need to go in sooner to be monitored? Last time I was also GBS positive, so I'm thinking if this time around I'm again still GBS positive while trying to VBAC, they probably won't let me labor at home for too long. Okay. So I talk all about this one. All of you VBAC mamas, you have to take my VBAC class. I literally pulled all the things from all the things and all the research data. I slaved over this class. It is just a wealth of knowledge, literally everything you need to know, how to talk to your provider, how to identify if you have a good one or not, what to expect from the process in my VBAC class. Excuse me. That being said, this is going to be very provider specific. So there's a fine line with VBAC, and this is where like I would suggest getting a doula or having like a very intense conversation with like specifics with your provider, because they're not going to want you to labor at home exactly the same as somebody who's had a vaginal birth or who's never had a baby before and doesn't have a previous C-section. but we want you to be actually in labor. And so that's where that sure signs of labor video is going to be really helpful for you. Probably they're going to give you a criteria. So you're going to ask your provider, at what frequency of my contractions do you want me to come to the hospital? And that frequency I want you to follow for sure. The other side piece that I think is most important alongside, they're still all the same importance, but like important to combine with that information is the sensation. Because if they say they want you to come in when your contractions are every 5 to 6 minutes, but you're like, okay, like this, that's probably not right, okay? What we would want is they're 5 to 6 minutes apart, but they're stopping you in your tracks. And that's kind of my phrase I use for identifying whether or not it's labor or not. So if it's stopping you in your tracks at the frequency they tell you, that's probably what you're looking at. As like a simple rule of thumb, of course, always default to them, but that's where, especially you VBAC mamas, you definitely want to have that conversation with your provider. And some providers are going to be really, really conservative and like at any first sign of anything, we want you in the hospital. And other ones are going to be like, yeah, labor at home till you think you're in labor. Some may not even treat you any different than somebody who's had a vaginal birth before. So flex and flow. But talk to your provider about it and they'll give you a criteria. But otherwise, it's going to be, we do want you actually in labor. So this comes from my vaginal exam video. Brittany Russell says, I just had my baby 2.5 weeks ago. I had a really long labor, 54 hours. God bless you, Brittany. My labor stalled several times due to a swollen cervix. Doc wanted to do a C-section because of all the stalls. I was stuck at 9 centimeters and 60% efface. I suggested IV Benadryl to see if that would help the swollen cervix. Sure enough, it did the trick. An hour later, my baby was in my arms and no C-section. My question is, have you seen IV Benadryl used for a swollen cervix? First of all, Brittany, I want to tell you, bless you for advocating for yourself. So this is something that I think there's so many facets I could talk about this question. I think it's so good. The swollen cervix thing I'll talk about, but I also want to say that like you are in control of your birth. And so I think a lot of times we go to the hospital and it's like, yes, doctor, yes, nurse, yes, nurse. And of course, like they're the experts in the room, but they're a resource to you. And if you don't feel good about something, ask questions. I don't know where the heck you heard about swollen cervix and Benadryl because it is a thing, but good for you for doing your research and being educated to ask for it. So swollen cervix, what does that mean? And this is why we don't want you pushing on a cervix that's not totally dilated. What it means is normally your cervix, right, is thick and hard. It thins out and it dilates. If the baby, and usually it has to do with a malposition of the baby. What does malposition mean? That just means that the baby is not totally twisted in the right way. They're not facing the right direction. Their head is down, but maybe they're like hitting on the cervix some way or hitting on the pelvis, and it's like traumatizing your poor cervix in there, swelling it up. So a lot of times, if you have a swollen cervix, my suggestion is, and this goes for nurses too, is get the pressure off of the cervix because it's like trauma. We get swollen because of trauma, right? If I punch myself in the face, someone punches me in the face, I'm going to swell up because of that trauma to my face. It's an inflammatory response. And so get mom on all fours, yes, with an epidural, butt in the air to relieve the pressure on the cervix. You can do ice on a glove. So you can literally like fill a glove with ice and put the ice inside to help deswell the cervix. IV Benadryl, people have used to help. There isn't a ton of evidence on this. It's like a relatively new thing. And honestly, it's probably like 3-4 years we were starting to do it when I was still in the hospital. And now I do see it pretty regularly with my clients if it were to happen. Although I haven't had a swollen cervix for a while now, knock on wood. But in general, IV Benadryl or Benadryl is going to unswell things. And so it can help, and it has been shown to help unswell the cervix. And so what I want you to think about, especially if you're a labor and delivery nurse, which by the way, all you L&D nurses, shout out to you. There is more coming here for you soon. And if you haven't joined our mentorship, make sure you check that out. I'll link it down below because we have a lot of really cool things happening for labor and delivery nurses. But for you, it's the idea you want to think that there's probably something not aligning in there. And so we want to rotate you every 20 minutes at that point. Make sure we're getting pressure off the cervix and helping to encourage that baby to rotate in the right way. Ice, Benadryl. There might be something else that I can't think of right now, but that's what I got off the top of my head. Love that question. This is fun. This one, and then we're going to go to Instagram. So Shelby Wilson says, does being a birth coach ever give you bad baby fever? I want to be a doula, but I'm way too scared it would make me want more kids, and I'm all done having babies. So the answer to this is a personal one, but the answer is yes and no. A lot of times I'm like, wow, that was so beautiful. Oh my gosh, I'm so happy for them. And then I also think about the reality of my life and having a child right now that like it doesn't work, but definitely there are some births where I'm like, oh, yes, let's do that. And then other times where I'm like, oh, no. It's like really good birth control. So many blood pressure questions this month, guys. Oh my goodness. So can you explain post-birth preeclampsia, eclampsia, and how to prevent it? Is it a really bad thing if my blood pressure is on the slightly high? So I guess I probably need to do a preeclampsia one, and talking about blood pressures because this is all over the place. What I would say is, especially to the one that it says, is it a really bad thing if my blood pressure is on the slightly high? Slightly high, it's going to be a wait and see, but there may be something brewing, so you do want to pay attention to it. Blood pressure issues are not something that we want to mess around with. This is something we really care about, and it can be pretty serious. And so if you have a little bit of a high blood pressure, just hang out. Don't stress about it. Talk to your provider about it. They may have you take your blood pressure at home. And then if it's elevated or if it's too high or you're having signs and symptoms of preeclampsia, which I talk about in my warning signs to go to the hospital video, then call your doctor. But again, it's not something to be like, oh, I hope it gets better. It's probably not. If you're truly developing a preeclampsia, gestational hypertension situation, it will not get better until you deliver the baby. So I'm not going to name this person only out of confidentiality, but somebody says, how do I overcome a traumatic birth experience? So I have a lot to say about this one. The number one recommendation I would say is to talk to someone about it. So talk to your OB, get a recommendation for a perinatal psychologist, psychiatrist. Processing the birth memory rather than holding it in. It's like, imagine you hold it in and it's just like stirring, and we got to like break the cycle so it doesn't continue to stir and it can just sit there as a memory, right? And not one that quite causes all this upset in us. So talk to someone about your birth experience, get it out there, process how you're feeling, identify how you're feeling, go to therapy, do some self-care, and it is going to take some time, but I also have seen literally from like one session with me or one session with a psychologist, and slowly over time, people truly getting better to the place where they can have babies again, they can have healing birth memories. And a lot of times for me, what I end up doing in those one-on-ones is I end up answering a bunch of questions from a medical perspective of like, this led to the, and it's just education. Honestly, it's helping sort out their brain, asking really good questions and seeing where you feel, where you lie, affirming you in what you did or didn't do. And so number one, easy, quick answer, and this could be a whole nother video, would be talk about it. Get it out. Find somebody safe, whether that be a friend, a therapist, another person that you trust, and process the memory so that it gets out of that cycle. So this is another anonymous one. I'll keep anonymous just for this person. She says, sex after baby. I'm 7 months postpartum. Sex is painful with lube and I have no desire. This is probably hormonal. There's probably some like life stuff going on. There may also be like some pelvic floor stuff. And so I would first of all talk to your OB about it to make sure that you're evaluated for any kind of like medical issues. I want to say pelvic floor injury or something else. If you're breastfeeding that lube, it's like your vagina tissues, they're gonna change, right? And lube may not be enough. I always say number one is make sure you anticipate using lube when you resume sex again after birth, because especially breastfeeding and those hormones can make you extra dry. A lot of foreplay, lots of communication with your doctor, working with a therapist, a psychologist, making sure that there isn't any kind of like anxiety or depression going on and getting treated for that. Also just time. I think 7 months is a long time to have no desire and to not be really having sex anymore. And so with help, it can get better, but that's where I think like I can give you all the tips in the world, but to see somebody and develop an individualized care plan, even like a sex therapist, that can be really helpful. There's a new book out by Orgasmic Birth. I can link down below that's all about sex post-baby. If you want me to try to get her on this channel, I would love to interview this woman and talk all about sex post-baby. So let me know if you want that question, but I will link a book down below as well. That's what I have for like a short answer, but I am brewing like a sex after baby and tips for sex after baby because I want you living your best life, and that not having sex, having painful sex and no desire, no one wants to live with. So let's get you some help and then you'll feel better. Okay. This one was everywhere with Instagram, everywhere. Everyone this month was asking about labial tears. When I talk about tears, you can go to my vaginal tearing video for this one, and I know everybody is stressed about tears. The most common tear is from vagina hole to booty hole, okay? And hopefully it doesn't go all the way to your booty hole. It's graded from 1 to 4, first to 4th degrees, and then, but your vagina can tear anywhere, and hopefully not like that, okay? Hopefully not. But it can tear into your labia, it can tear into your urethra, which can make peeing really uncomfortable. It can tear up to the clitoris, which you can imagine that must hurt a lot. It can tear inside, it can tear in your cervix, literally anything can tear down there. And so if you have a labial tear, usually they'll just stitch it up. Honestly, to me, not that we're grading tears, but labial tears are gonna be less concerning from a medical perspective than a perineal tear, because we wanna make sure that it's not tearing into the muscle, into the rectum, so there isn't like one hole down there, okay? So a labial tear, stitch it up, no big deal. It will heal. It does go back together. They're still just as healing tissues as before. It can happen. You can tear anywhere, and typically throw a couple stitches in, give it some time, some sitz baths. Watch my vaginal healing video. I'll link that one as well. And in theory, you should be good to go. Reza says, does a low-lying placenta lower my chance of a natural birth? And by that, I think she means a vaginal birth. / anything about low-lying placenta, will it go up by time? So this has to do with placenta previa. So this is a complication of pregnancy. If you don't follow me on Instagram, make sure you go to Instagram, because I did do like a drawing video thing that shows you where the placentas can be and what the types of placenta previas are. So a placenta previa is just where you have cervix and the placenta is blocking the cervix. So baby can't go through your placenta out your vagina. It does mean a C-section, but your placenta early on in the pregnancy can be what we call low-lying. This is super common, and most of the time you'll see it early on in the pregnancy and it'll be close to the cervix, and then as your uterus grows, guess what? The placenta is gonna move out of the way. There is a certain length that it has to be from the cervix that your doctor will look at, and then they'll tell you whether you rule in for a vaginal birth. So if you are early on in your pregnancy, let's say you're anywhere less than 30 weeks, I would anticipate that yes, you can have a vaginal birth as long as it's not covering the cervix or touching the cervix. If it's just low-lying, give it some time. They'll watch it on ultrasound, and eventually, most of the time, it is gonna move out of the way. Brittany M. Betzer says, if I had back labor in my first labor, do I have a higher chance of having it again? And back labor, guys, OP babies, posterior babies, I know I've been saying it, but it is coming. It's in the queue. I just want to do it justice. So I keep like getting nervous to do it because I'm like, once it's out there, it's out there. And I know I can do like an addendum or something, but I really want to do this one justice because I know it's so popular. So back labor just means that you had most of the pain in your lower back, usually like in your tailbone a lot of times, and it has to do with the position of the baby in the pelvis. So instead of baby facing down when they come out like, hey, what's up? Looking at you. And so it can, because the back of the head pushes on the back of the sacrum or your tailbone, and it like pulls and stretches all the ligaments and muscles down there. And so it can cause a longer labor. It can be really uncomfortable, and particularly for your back. So if you had it the first time, nope, you don't have a higher chance of it happening with your second. Maybe if there were structural, like your pelvis is shaped a certain way, but in general, new pregnancy, new baby, new position of baby, same pelvis, but either way, it's more about the rotation of the baby in the pelvis and what happens in labor, your positions, etc. Let it all go, reset button, no stress, clean slate. This came from a live I did on Instagram. So I do go live over there pretty regularly. flex and flow on that one, but then I'll answer your questions live on the regular. Like if I'm sitting here and I'm like, oh, I like have a moment, like let's talk. And so I'll connect with you guys that way. So make sure you go over there. Kendra221 said, does using a birthing ball to engage the baby work better if the baby is awake or sleeping? Okay, so I had this question in this live and I was like, oh, my initial thought was, it doesn't matter, because really what you're doing with the how to engage your baby video is you're rocking your hips back and forth, right? And it's more about encouraging movement in the hips / the pelvis to encourage the baby in one direction or another to kind of twist and turn and engage or kind of sink into the pelvis. But then I was thinking about it, and literally this was like a live moment. It may actually be on an IGTV, is that if the baby's awake, they may be able to kind of like actively be like, oh no, that doesn't feel good. And they may be more encouraged versus like laying there and just you rocking them. It's like, oh no, it doesn't go that way. Oh, I want to kind of help and tuck my head and turn because it feels better. So actually, this is total hypothesis. This is completely just a Sarah bonus as like my own rationalization. But let's say you are doing some of those engaging the baby exercises, which you can start at any point in your pregnancy. Technically, it won't really help to engage the baby until later, but early on, it's great for your hips to open everything up. But if maybe you're like sitting there and you're like, oh, my baby's awake, I was gonna do that in 20 minutes, get on the ball. I think it might be better, loosely better, to do it when the baby's awake, because then they can kind of help you. Living Exploring says, how do I maintain my milk supply while also letting my husband do some breast milk bottle feeds? Love it. This may be something that you're very interested in. I know, especially with breastfeeding, it can feel really like you're tied down, like you're at work all the time. And it is nice to be able to step away from your infant. So how you maintain your milk supply is by pumping. So I think a lot of times people think that like, oh, we'll just give a bottle and then I can skip any kind of feed or pump session, but really that is what is going to impact your milk supply the most. And so let's say at the nighttime or in the daytime, your husband wants to give a bottle, that's totally fine, but you still have to pump. And you need to do like a full empty the breast, however long it takes to empty your breast, but 15, 20 minutes-ish, both breasts to empty the breast, because remember the key is tell your body to make more. So if you tell your body, hey, someone's drinking my milk, your milk supply should in theory maintain, and that's how you give a bottle. So it's not so much about less work. You may be able to space out your feeds and play with that, but I wouldn't go cold turkey. I wouldn't just be like, oh, I'm gonna skip one and go 8 hours without feeding, because then you risk engorgement, clogged milk ducts, all the things you don't want. And so just keep removing the milk regularly through pumping and you should be good to go. These birth traumas, guys. Oh, I feel you so much. So this person says, I had a traumatic birth, but I want a second baby someday. Advice for coping. Quick advice for coping is education, empowering yourself with the knowledge to make decisions and know how to speak up for yourself, hiring a doula or a birth coach, trusting in your provider, changing your birth environment. That one usually, some people are okay, but a lot of times if you've had a traumatic birth in one place, I do suggest delivering in a different hospital so it doesn't kind of trigger you from the first one. And then education and support. That's going to be the biggest things. That, and then also taking the time to heal prior to getting pregnant. Mind you, if you're pregnant again, then it's like, let's get in therapy, let's talk through, and let's process our birth. Again, I do this, guys. So if you want to purchase a 1-hour session with me, I love doing this. And again, I'm no therapist, but I do love to listen and I do have some insight to maybe help. And so process the first birth. Try to kind of close that chapter and reset your body for this next birth and remind yourself that this birth is not the last one. You literally are clean slate, new baby, all done. Try again in a different way. And so there are some strategies to do that, but definitely education and support is what I see, because I do get a lot of those clients that had a traumatic first birth that the second time around they want something else, and so they hire me. And so I see that education and support really, really, truly make a difference. And then closing the chapter through some therapy work, through some talk, through some processing, through identifying what worked, what didn't work, etc., that you can do prior. Oh, LBTBGB says nephew update. Oh, I love you guys. So here he is. I will post a video / picture of him here. He is the sweetest, most perfect little child. He barely cries. They'll put him down to sleep and he'll be like, ah, ah, ah. And I only know this because I totally stalk him on the Nanette from here in LA. And I'm actually going to see them in November. So if you don't follow me on Bundle Birth Instagram or my personal Instagram, I will be on stories. You will see updates of him if you care. You're so sweet for asking. He is the sweetest, most precious thing. He has great hand-eye coordination. He's rolling over. He's no longer swaddled. He's like scooting around and saying, ma, 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 ma. I can't. It's too much for my heart. And I'm so excited to see him soon. All right, so this person had a miscarriage after 1 healthy pregnancy. Is that normal? Should I talk with my doctor? So first of all, miscarriage is extremely normal. I literally just got through a 2-day, full-day bereavement training for being a bereavement counselor to be able to work with mamas who've had losses and be able to train nurses to work with mamas who've had losses. So if you've had a loss, my heart goes out to you. It is one of the most painful things, no matter what gestation, whether it was 4 weeks or 40 weeks, it is so painful. And obviously grief is different for everyone. Some people manage really well and other people, they really struggle with it for a very long time. And so what I want to say is that yes, having a miscarriage is totally normal, way more common than we ever think it is. And in fact, if you feel comfortable sharing if you've had a miscarriage and telling us your story, feel free to put that in the comment box down below. And I would just ask that, guys, we're really sensitive to each other here, that this is a safe place. I know it's online and social media and people are not always the nicest on social media, but I really dream of this being a place where you really can share and receive some love and encouragement and support. So if you see someone share, be like, I'm so proud of you for sharing. Thank you for telling your story. Thank you for sharing XYZ. This really helped me in this way, that way. Okay, so that's number 1. To know that you're not alone, and yes, it is normal, and yes, you should talk to your doctor. Mind you, I don't know that it will necessarily change anything. Usually they say the recommendation for waiting between a miscarriage to the next one is when you feel ready. So you don't necessarily have to wait a certain number of months. If it was a full-term pregnancy that resulted in a stillbirth, then that would be more like the 18-month recommendation, but even that is very loose. And so when you feel ready, feel free to try again. Always remembering that baby being so important as a huge part of your family that was such a loss and so can be so painful for a lot of people. And so talk with your doctor and then they'll figure out a plan of care to kind of watch and see and maybe do some testing, figure out was there a cause of it, etc. So there's lots of things. It also depends on the gestational age, how developed the baby was, etc. But yeah, absolutely. Let them know you had a miscarriage and they'll go, okay, we'll note it in your chart and we'll see what happens next time. I don't know how, hopefully they'll be very supportive. I don't know that I've heard of a doctor be that supportive with the miscarriage, but they also may do some testing for you. KJ Nip says, pain with letdown and shooting pain in my breast throughout the day. Totally normal. I'm sorry. I know. The breast pain is probably milk production. It may be letdown. It may be something else, as long as it kind of shoots and goes away versus is that dull pain or you feel any hard lumps in your breasts. That's different, but in general, some sharp shooting pains and then pain with letdown. Letdown can be very uncomfortable. And a lot of times for that first minute or so, we usually say 60 seconds, that if it's whoo, whoa, ha, and then it should subside. If it doesn't subside, then relatch your baby. It usually means there might be a latch issue. That's the very simple version to that. But yes, the letdown can be really uncomfortable. Thanks everyone for being with me here today. If you want more from me, you can head on over to bundlebirth.com. Check out my website. I have tons of classes over there. If you haven't taken one of my classes, today is the day. This is your sign. Sign up for those classes and get yourself nice and educated so you can advocate for yourself and feel so much better and control what you can control to help you lead to a more positive birth memory. Make sure you follow me on Instagram so that you can learn more about any and all things pregnancy, labor, birth, and life. And then make sure you subscribe down below. Click your notification bell so you get notified when I post a future video. And then until next time, don't forget to flex and flow, and I will see you soon. Bye.